Tata Curve ka trendsetter SUV ka bawandar kalapoy ha Shillong. One ban test drive ka coupe SUV paninggong ekari ani pilaban phone ni number bala ay harum.
Ri Kyrteng is Director of Health Service Research at Medical Education and Research. Umintri Rambau Konrad Ki Sangma, Ulapan Tip Mentakasngi Bakasokar Klarai, Ban Pinkala Kyrteng, Bat Karukom Trekam, Director of Health Services Research, Shaka Medical Education and Research. Kani kasin jam Bakasokar Klashim, Kalong Hadin, Balas Dang Yak PE Sama Medical College, Barkum Jo Yak Shillong Medical College, Kan Stang Class No Menthausnem. Kani kalong kabadan kam bandon ka Directorate jong ka Medical Education and Research katkum ki kendon ka Sokar India. Hakajo ka por umentri rangbao la pentip ka Sokar kala minjur ya ka Meghalaya Medical Attendant School a cha apwe. Kani kalong na kabenta ka jingburia ya ka bai suma jikinong tre Sokar balingba kani ka pya ya ki kerdan ba pher katkum ka jingsha suma jing ki jingpang bar ka Sokar kan buria baro ka jinglo jingsap ba sha suma. Hakajo ka po ka Sokar kalapin kalaru ek mandatory medical service policy na kabenta ki samla puli doktor hakaba kalabusu ek contain mandatory but gitu ki balapendap ek jing puli doktor kin habantre ba ka Sokar henre gitu ki batre haki hospital ki bomde Sokar tang ba hapo ka jylla karam don ka jingte.
We have also decided today in the cabinet to basically rename the Director of Health Services Research. We'll be changing the name as well as the functioning into the DHS Medical Education and Research. This of course is being done because, as you're aware, that we have already started the medical college in the PS Sangma Medical College, which is started by the private entity. And at the same time, we have also informed all of you that the Shillong Medical College also is expected to start this year itself in 2025 in the academic year, which is going to be sometime in September, October. And so therefore it is now necessary for us to have a directorate as per the norms of Government of India that looks into this aspect. So therefore we already have a directorate of health services research. So that is now being expanded into the Directorate of Medical Education and Research. So that's the only thing. So while the names are there, of course, the roles and responsibilities that they will have has also been defined, which will be related mostly to the admission process and overall monitoring and supervision of the medical education aspect of this entire thing. So therefore, that's an important decision that was taken today in the cabinet. We have also today decided to approve the amendment of the Meghalaya Medical Attendance Rules 2021. To simplify things, basically this is the medical reimbursement that is given to the government employees. Earlier, because of different issues and concerns, we had been following the CGHS criteria for almost all the different kind of ailments and different kind of treatments that were there, and which was becoming a problem for a large number of the employees. And hence there was assessment that was done by the department, and the department has proposed that we classify different ailments into different categories. And so for the common disease that are there, again this whole list is there. I don't have time to go into all of those things, but basic classification I'm informing you that the common diseases that are there, the rates of the CGS or the MHIS / either one will be implemented. But for the more serious nature, where there is like emergency and life-threatening cases, or there is a rare disease and surgical interventions required, for these the CGHS rates will not apply anymore. And as I said, especially cases like the emergency life-threatening cases which are there, the cabinet today has decided that we will go for 100% of the bill amount to be cleared as per the treatment that was given. And this will also be done without needing any kind of prior approval at the government level, and the DHS MI will be given the powers to make that decision, so that the process of reimbursement and paying of bills, especially in life-threatening cases, is done without any hassle and on time, so that the government employees can get the support as and when they need it. So earlier there was a lot of procedures were involved, and a different kind of aspects were there, approvals were required, which were sometimes very time consuming. And more importantly, the rates that were being given under CGS were not enough for the treatments that they were going through. And hence now this will ensure that the amount is given as per actual. And more importantly, as I said, the procedure will be really smoothened, so that the prior approval is not required before they go in, and a simple green signal from the DHS MI will be there. Of course, there are many aspects and many criteria in this. This again will come out in the form of a notification, and that will have more of the details. But in principle, we have done this, as I said, to ensure that the government employees they get support the time they need, and also the amount that is being given. Also, procedures have been streamlined, so we will be actually having a format and a system in which we will be ensuring that certain formats have to be followed in a very simple way, where the inputs that will come in from the hospitals will be taken, so that as I said, the process is made much smoother. So this is being done mainly for supporting the government employees and ensuring that we minimize the problems when they're going for treatment or any kind of emergency life-threatening cases, and operations have to be done on an emergency basis. So this will help all the government employees to a large level. Amended the mandatory medical service policy for medical students for UG and PG pursuing academic curriculum under the state government sponsorship, or as we call it, the state quota. If you remember earlier, there used to be a time frame and 5 years of mandatory service under the MBBS graduate, or 30 lakhs for the bond. Then similarly for PG specialists, minimum 3 years or 1 crore amount had to be paid. And for PG diploma, again 1 year or 20 lakhs to be paid. So what we have done in this is that number one, we are not calling it a bond anymore. We are naming it as mandatory medical service policy, just to give the right nomenclature. And number two, we are also including an exemption in this, where the doctors, when they come and they work in not-for-profit organizations and central institutions. So not-for-profit hospitals mean the hospitals that are, as per the norms, they're following the not-for-profit procedures and different aspects. There's a classification for it. So once they fall under that category, then the doctors working in that hospital, so for example, NIGREMS is a central institution. For example, the Holy Cross or the Dr. Norman Tunnel Hospital, and so on and so forth. Hospitals like these, which are in that not-for-profit organization category, the doctors who work in those hospitals will also be exempted from mandatory service in government hospitals. This again, as I said, is being done with the view that they are serving the people of the state by being in the state. So even if they're not serving in a government run hospital, they will be within the state. So therefore, we are giving that exemption in this. And we are also looking at it from the point of view that we are hopeful that in the days and years to come, we will be having more of our medical doctors coming in. And we expect the numbers to almost double, if not triple, in the next 5 years' time. So keeping in mind of all these aspects, we are looking at how to make this entire employment and the entire services being given by these doctors to be most productive. So this is what was decided today for the mandatory medical service policy, and we have come out, as I said, with the new norms as well as the exemption for the not-for-profit organizations and hospitals. This is just a normal procedure. Basically, there was the employment of manual scavengers and construction of dry latrines Prohibition Act 1993, which has prohibited people working in sewers and all this kind of activity to obviously protect them. And if you recall, Government of India had come out with a new act in 2013, and hence for us we have to pass a resolution in the House, and all states have to do it, to repeal the employment of manual scavengers and construction of dry latrines Prohibition Act 1993, which has to be repealed by Government of India in the Parliament. But the resolutions have to be passed by the states and sent to the to Government of India, and that resolution will be passed by us, which will further facilitate the repeal of this act at the Parliament level. The Governor's address, which was finalized today, and the Cabinet has approved the Governor's address, which will be read out by the Honorable Governor on the 28th of this month, the first day of the Assembly session. So that's all.